Okay, now what we're going to do is we're going to do an Achilles taping. So what we're worried about here is we're worried about Achilles tendonitis or an Achilles strain. So what we're trying to do is we're trying to provide some assistance pulling the foot into plantar flexion. So every single time he plantar flexes, we want to provide some assistance. So what we're going to do is we're going to use some of this elastic bandage called Elasticon, because it's pretty strong, but it does have some nice good elastic principles to it. Okay. So here again, what I'm going to do is I'm going to, just for demonstration purposes, use some of the Power Flex. But in a normal situation, you would want to go directly onto the skin. You would not want to have any type of, you want to have them clean and shaven, because you want to be able to secure this directly out of the skin. But I'm just going to use this here, again, just so you can see it just a little bit better. Okay. So the first thing we're going to do is, just like our ankle taping, we're going to provide a couple of anchors. Okay. Up at the very top of the foot. We're actually going to then also place an anchor down lower, nice and loose, okay, here around the, kind of fairly close to the balls of the feet. Again, I don't really like to get this too terribly tight. And what we're going to do now is we're going to tape from here down behind the calcaneus up past the Achilles, and then secure it onto there. And so what we want to have him do is just the opposite of the ankle, is we want to have him in a plantar flex position. That way when he goes and steps down, it's going to tighten up, and that's going to want to push his foot down into plantar flexion. So we take our scissors and we cut a piece, kind of measure it to fit here. If we have to recut, that's okay. So the first piece is going to start, and it's going to come down here at that anchor at the balls of the feet. Again, you can see he's plantar flexed. Secure this on. We're going to pull this pretty much about as tight as we can, and bring this and secure that onto those anchors. Rub that down. Okay. And we're going to do one more, because typically athletes are pretty strong in their Achilles, and so we want to provide as much elastic support and adhesive support as we possibly can. So we're going to place this one down here again. Okay. The only difference with the second piece is we're going to cut it right down the middle. Okay. So as we come, this actually allows us to pull this tight and then secure it actually around the leg like this. Now what that's just going to do is that's going to help kind of just hold it up just a little bit more. Okay. So now if I had him step down, because these aren't secured down, they would just pop right off. So you do need to do is then again you need to come and secure these pieces down. This. Secure these pieces down at the top. Okay. And there again, now he's pretty much ready to go. You want to check for circulation, make sure it's not too tight. I could also use the elastic bandage just to make sure that everything holds down nice and secure and tight. None of these things bulge around. Okay. Alright. So now when he goes into dorsiflexion, that elastic bandage is going to tighten up, and so it's going to want to actually spring him down. So it's going to take a lot of the pressure actually off the Achilles, so that way he can kind of walk around and move around. Now, a modification of this is if you had anterior tibialis issues or extensor digitorum issues, you could actually reverse this around and put our tape actually on the top side. And we call this a reverse Achilles. And then so every single time they plantar flex, it actually assists them in dorsiflexion. So you can do it either way. It doesn't really, matter. But just all you have to do is determine what muscles are we trying to assist, and then apply the tape to help with that.